I started doing podcasts recently, and then it's a matter of making sure, will the camera work? Now you gotta make sure the microphone's working and everything. So since it is that time, meeting of the Dundee Township Mental Health Board of February the 13th, 2025 is called to order. Will the Acting Secretary please call the roll?
Adame. Auger. Here. Connell. Corrins.
Here.
Kemp. Thrower.
Here.
You have a quorum?
And President Avalar? Here.
Avler. I always forget that.
So we have a quorum with 4, so we're good. I would like to ask our distinguished guest from the McHenry County Mental Health Board, Ms. Lindsay Kyman, would you lead us in the Pledge of Allegiance, please? Please all rise.
I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Amen. Chair will entertain a motion to approve the agenda as presented.
I'll move.
I'll second.
Moved by Auger, seconded by Thrower. Discussion? All those in favor, please signify by saying aye. Aye. All opposed, same sign. The agenda is approved. Chair will entertain a motion to approve the meeting minutes of January the 9th, 2025 regular meeting as presented.
I'll move.
Moved by Auger.
Second.
Second by Corrins. Any discussions? One quick question. So we didn't defer I want to make sure that we do this right. We didn't defer the January financial. We didn't approve it either, though. So will that be inclusive in the February financial later in the agenda, or what?
It was deferred, so.
No. It failed according to.
Yeah, it failed.
It failed, so.
That's a good question.
Okay. My apologies, I should have caught this sooner.
I didn't think about that either.
Okay, I'll keep that open for that spot in the agenda. If there's no more discussion, all those in favor of approving the minutes as presented, please signify by saying aye. Aye. All opposed, same sign. Minutes are approved. We will now move to public comment, and we will begin with Ms. Lindsay Kyman, who has signed up for public comment, and you have up to 3 minutes to address the board.
Great. Thanks so much. I know it's been a couple months since I've been here, and I apologize. The switch from Mondays to Thursdays kind of interfered with some of my stuff, so I'm going to do my best to be here. But I wanted to give an update on our Minds Matter program. I know we got the work plan all done by the end of last month, and we took the first week of February by storm, and I wanted to give some updates on what we've reached out to. So Jarrett and I will be planning a meeting here soon to coordinate a little bit about where we can integrate more and to get materials and things to get more news about the Dundee Township Mental Health Board, the services out into the community when we do presentations. I'm happy to report that we've reached out to 3 chambers of commerces, we've reached out to 4 library systems, and I've been in touch with 4 congregations already that have all shown interest in some of our programs. We are in the coordinating, figuring it out stage as far as the logistics of those programs, but I did want to let you know all that we have a website page up and live, and in that it lists kind of a variety of topics and attendance and audiences that we could speak to. And then just as a general reminder, we're always happy to meet the needs of like a specific request as well. It doesn't need to be something on that list. So I wanted to share with you just a quick flyer that we put together. I wanted you guys to have this. This is the information that we're giving to different people as a general. I've asked for this to get sent out to people who have audience lists and email lists just to be on there. The QR code at the bottom will take you to the website page, and it's as simple as people filling out a form to start the conversation, say what they're interested in, and then we reach out to them from there. So far, to share with you some of the topics of interest, this one came from the Dundee Library. They would like us to do a series including 5 different topics: calming an anxious mind, parenting someone with attention deficit disorder, care for the caregiver, staying connected through mindfulness, and stress relief for seniors. Those were some of the topics that were of interest that came at us. So we're super excited about that, hitting the ground running. Would love your support. If there are people that you think we should meet that would love to talk with us, that have an audience where we can get out there, please connect them with me or through Jarrett with me, or go ahead and just do this form. And that's all my updates on that, 3 minutes or less. So
Thank you.
so much for your continued support. I appreciate it.
Thank you so much. Thank you. All right, if there's no other public comment, we will now move to the coordinators report, Mr. Sanchez, and we'll refer to the screen for our members in the audience.
Sorry, I forgot to pull it up separately, so I'm just going to scroll quickly.
There it is.
Just update on the lost hours. We're at 25 of 60 as of last week. And just, it's ambitious, but on track for completing it by the end of this month. The police social worker program was hoping to have the business plan and proposal in front of you this week. Chief Shaver is still coordinating with the other police chiefs in the area. He just wanted to have a meeting of the minds just amongst them to go over some things. I think some of the things that are really beyond our scope as far as, who's going to fund what and the type of position that the sharing that they'll have is what he wants to discuss with them. So hopefully that will occur this month and we'll be able to bring this to you next month. Other items, meeting recordings. As you are all aware of, we are now recording the meetings. So it will add a little bit of time to my months, but because of that, we won't need such detailed minutes, so it will more or less offset the amount of time that I spend on the minutes with the recording. There's just some things that have to be done in order to, you want a title page on your videos and editing the audio in case, the public speaker, you can't hear them so well or things like that. But other than that, it's pretty straightforward. I created a simple guide for anybody that would need to set up meeting recordings so that they know the equipment involved, all the cords, everything that they have to do. Keep it pretty simple. The communications tracker, it was requested I start tracking all of those. So those go out every week with the task update in PDF form. The ride and cane cost tracker is on the members page. The basic spreadsheet that contains the list of eligible riders that we've identified as well as the formulas used. The formulas are used on the activity reports that come in. So we get two different documents from Kane County. There's the invoice itself that gives you the total amount and the number of rides and some other extraneous information that is uninteresting for us. The activity report itself is anywhere from 300 to 500 rows of all of the rides that occur in Dundee Township each month. And that's the document that I manipulate with the various formulas to determine how many eligible rides that we have each month. And by that, we know how much we can reimburse. And we'll talk about that later. It's something President Avalar and I were discussing, whether to have separate resolutions for the ride and cane, or does the allocation resolution cover everything? So we can talk about that when we get to that part of the agenda. The grant application update. This is something President Avalar and Member Auger, we have talked about, so we'll be meeting sometime soon and just try and update that application, just take ideas that we might have, how to streamline the process, make things more simple. Looking forward to the next grant cycle. And then stakeholders meeting, because the police social worker program has been kind of in a bit of a limbo. We've been holding back, but I think we're going to be scheduling one of those, the next one for April. And then I know, Ray, you had a couple questions. Let me just make sure I covered everything.
Yeah, so you indicated you're on track for the lost hours. You clarified that the police social worker program application is going to be brought back to us in March.
Hopefully.
Well,
Yeah.
that's
It's
the plan.
outside his
It's not-
control, but sort of that's the plan.
The plan,
Yeah.
what I was trying to clarify, it's not going back to the Carpentersville Police Department. The plan is to bring it back to us at that time.
Yeah.
Okay.
Once they have the meeting of the chiefs, then hopefully they'll be saying, okay, we're ready.
Okay. I'd like to see the recording document posted on the website, perhaps under, under the members page or some place where we can access it.
Which
I'm
document?
about to say, clarify which recording document.
So you indicated that you had put together a document to how to set up the recordings and how to get everything set.
Yeah.
Correct.
I'd like to see that put on the website in some way so people can access it and not have to rely on a paper copy.
And I know Mr. Sanchez had this in soft copy. He had some issues with his computer, so he will have to reproduce this, but it will be posted
Okay,
per your request, but we
great.
do have it.
Yeah, and then we're going to talk about the cane, Wright and Cane a little bit later. Similar comment on goal 1. I guess we're not onto the goals yet, so much for that. We'll wait for the goals.
Okay, before we move on to the goals, I assume that's next, right?
Yeah.
Okay, before we move on to goals, any other questions from other board members? All right, let's go ahead and move on. I'll cut my questions at the end.
Okay, not much to update really on our goals for this month. Just kind of working on some back-end stuff. Again, waiting on the police social worker program. Well, that's a different goal, but the year-end survey of results, that's something that we weren't going to be doing yet. So let's see. Go to, the contracts and work plans. There was one that had to come in much later than expected, so I was waiting for that, and I just did finally receive that the other day. So they will all be uploaded formally on the website for you guys to just have access to the final signed documentation for the work plans and the contracts. That's pretty much it. There's not really too much major stuff as far as the actual goals that we've had to go over this month. There are some policies that I've worked on, but per our policy adoption process, it has to go to President Avalar, get some feedback, and then President Pro Tem Auger, and then have a draft that comes forward to the board. President Avalar and I were talking about this the other day, so I think next month we'll have multiple policies coming forward. Some of them will be very simple, so we could approve multiples at once. So be looking forward to those for next month. And and then obviously we'll be talking about planning later on in the agenda.
Good. Okay, is there anything else on your? Okay.
No.
Any other questions or comments to the coordinator? I do have one I want to make about the police social worker program. I think the board also recognizes that it's kind of beyond your control where it's at right now with the village of Carpentersville. Certainly something that I brought it up at the public safety meeting in this room on Monday night. But over the last week, the Sonia Massey case has been making news, especially the settlement with Sangamon County. And obviously, we don't want any law enforcement to go through what's going through down there, let alone families and of the patients themselves. And certainly, the groundwork we're laying with our police social worker program will help to the best point possible in prevention, stop something like that from happening. So I'm definitely watching closely to ensure that the word's getting out. If any of y'all haven't read the Massey Commission report, I would suggest it is a good read when it comes to police social worker and crisis intervention. Certainly CIT, crisis intervention training, again, comes to the forefront. As some of y'all may know, Sangamon County is going to referendum in March for their own 708 board if it's approved. They're going through the property tax path, but it's a matter of all the things we try to do preventatively. We see these happen, we note them, and we're trying to avoid them here in our own community. And certainly I think we're off, even though we're barely 5 years old, it is still something that we're trying to be as proactive to address things as they come up. So I do thank you for the diligence. I know it's out of your control to get the final plan from Carpentersville, but let's continue that progress. And then you mentioned also the next community roundtable is going to be sometime in April likely. So that is also right after the ACMI, the Association of Community Mental Health Authorities of Illinois meeting, April's 3rd and 4th. So hopefully maybe that will glean us with what we can bring to the roundtable, and certainly with the all the stakeholders as they come in here and meet with us and discuss what they would like to see from the Dundee Township Mental Health Board, and how might we partner, particularly getting the word out about new legislation that went fully effective this year, particularly the mandate for all Illinois-based insurance carriers to allow for an annual mental health screening. Certainly, that's outside of our purview, except maybe providing information to residents that's now something that's changed at the first of this year. So we have to be as proactive as we can within reason, but certainly be proactive for our community. So with that, we're ready to move on from the coordinator's report and move to the financial report. The chair will entertain a motion to approve the list of bills of February financial report.
I'll move.
Moved by Thrower, second by Corrins. Discussion, Mr. Sanchez.
Again, pretty quiet month. We're just now starting to get in some invoices from service providers, but it wasn't in time for our agenda packet. So you will see a couple at least next month. I think, Ray, you had a question about the ride and cane, and shouldn't that be on here? And that's, I guess I would just ask board consensus on what you would want to do with that. It's a little different than a normal grant program, so I can simply put it in with, how we put it in with the other grant invoices and just throw it in with the financials and not have a separate resolution, because you did allocate $30,000, so as long as we don't go over that. But I did keep it separate on this month just out of caution, I suppose. So if that is the preference of the board, we can just include it with the financial report each month.
What is the consensus of the board? Consolidate?
Yeah, that makes sense.
Yeah.
And I think I have through December now, so it might be 2 months next month.
Yeah, there's stuff that just came in
Just
the
came
other
in.
day.
Okay, terrific. Okay, I think you have your consensus. Tonight we'll do it separate, but starting next month on the 13th of March, we'll do it. Okay, good. Any other points on this
No,
report?
got the branded swag in, so if you guys need any more pens or the push pull or push pop balls, we've got those if anybody needs one.
Believe me, this is the original one. It comes in handy, especially with air travel. I did not have it in the surgery room 2 weeks ago, but they do come in handy, yes. Okay, if there's any other questions or discussion?
Question, are we approving the the December and January financials? Because those were not approved pending the resolution of the hours that were being made up.
So,
Can we just wait till March?
I think
we can.
I think let's put it.
Yeah.
I think let's put it to March because it's projected. He's going to, Mr. Sanchez will have those hours done, and it's right now. It's only February 13th, March 13th. The entire fiscal year will be done, and I think it's more appropriate for March. We'll make sure it gets on the agenda. Though.
yeah.
Okay. Good. If there's no other discussion, Chair will ask for a roll call.
Auger.
Approved.
Corrins.
Approved.
Thrower.
Approved.
Avalar.
Approved. Financial report is approved. We move now to old business. Chair will entertain a motion to approve and authorize the board president to execute the 2025 Mental Health Board Grant Year Work Plan for Mathers Recovery Opiate Treatment Program allocated for $12,500.
I'll move.
Go ahead, Ray.
Move.
Ray will move, I'll second.
Moved and seconded. Okay, moved by Auger, seconded by Thrower. Discussion, Mr. Sanchez?
Everything's in. The revised application came in. You guys already had the work plans. President Avalar said we didn't need to have it printed out again tonight because we already have it. So if there's any questions on that, I can try and answer it to the best of my ability. But other than that, I think, Ray, you had said that it's what you were looking for as well.
Yeah, the only thing that I would, if we're opening it up to comments,
Go ahead.
President, we need to get the signature of the authorized party. They did not sign the revised application.
Okay, but the progression is we approve it, I'm authorized to
No.
sign it, and then they...
No, the application.
Oh, the application. Okay, I thought
The
you meant the
application
agreement.
was not signed by the party.
Yeah, and I've been in contact with them, so I'm waiting for that to come
right.
back.
Okay.
So long as we get that, that's fine.
Yeah.
Okay.
And then are we also approving the work plan? That's the other part of this?
Well, that's what the authorization is,
Okay.
is the work plan. The application essentially is just a revised one that, you can all accept as a consensus.
Okay, so then what I was not able to get from the work plan was how are we paying them? Are we paying them quarterly? Are we paying them per class? Are we paying them upon completion of a milestone? And, they say they're going to pick 15 clients for one of their programs. However, we, I thought, are supposed to only fund people who are receiving mental health services that require, Medicare, Medicaid? We have to make sure all of those other funding sources are exhausted.
Yeah, payer of
So-
last resort, that's in the contract.
Okay.
Correct.
But, we need to
and-
make sure that the people, they've stated in their application that, or in the work plan, they're going to select 15 clients from Dundee Township who will enroll in their OTP program.
Okay, I'm gonna suggest maybe, obviously pending the formal approval by the board tonight, when I sign as I'm authorized to execute that, then, and when you send the cover out for their signature, make sure that's very
Should
clarified.
remind them.
And remind them, just so that, obviously, it's a new vendor for us, so that's something that we want to make sure that they're on the same page.
Yeah, and I believe they had indicated quarterly for reporting.
Okay. Okay.
So we will pay them quarterly? Is that?
Yeah. That's my I don't have it in front of me, but I'm pretty sure that was what they had requested, was quarterly. Most of the service providers actually did request quarterly.
I mean, I think
invoicing.
FSA is the only one that doesn't request that does it monthly, so, okay.
I guess I'm unclear how, we're going to pay them a quarter of the amount every month or every quarter?
It's whatever they invoice us. So,
Yeah, so I'll work with them to develop the line item, so to speak, because they do have a very unique program, so that we can, if there's staff time, they break out the staff time. If there's a class, what's the cost for that class, and they can break that out separated in the invoice, so it's not just here's a lump sum.
Yeah.
Here's what we are saying that we did, and that's it.
Or is it like Centro where when the class is finished,
Yeah.
then we do the whole amount, or?
Yeah, that's what I'm trying to understand.
Well, part of
I
their
didn't see
program
any-
could be that, but other
Okay.
parts of it, it
It's
seems, it
different.
makes more sense to just have like, here's the staff time we spent in this 3-month period.
Right.
Okay, makes sense.
okay. Any more questions or discussion?
Nope.
All right, with that, Mr. Acting Secretary, please call the roll.
Auger,
Approved.
Gorens,
Approve.
Thrower,
Approve.
Evler.
Approved. Right, moving to number 9B, that is my update. This is more of a continuation from last month concerning the change to the Community Mental Health Act as far as the Mental Health Board having an advisory role per the statute that was implemented at towards the end of last year when the governor signed it. What happened here is this year, the Dundee Township Mental Health Board, and for transparency for our community, we have 3 board members who are up for appointment, 3 positions that are up for appointment. The first one is the governing board, which is currently occupied by member Thrower, and that term expires per statute on the last day of her current elected term on May the 18th. So that will be a vacancy at some point. So if the incoming board and the incoming supervisor want to continue to have a governing board member, it's only a pool of 5 candidates. So it's only 5. It's not like McHenry County, we can have 24 people or more. If there is clear indication that, let me back up. April 1st is the township election, as everyone's aware. The new board takes office on May the 19th. So there's 49 days in between the election and the swearing in, and 51 days to the first township board meeting of the new board. So the progression is presumably that there is at least one of the 5 who's willing to serve, and it's pretty much a clear cut who will get the appointment. If maybe more than one are interested, then definitely we'll present ourselves to the supervisor, as I've done even before this new law, that, if they want the mental health board to participate in any way to help, we're here for them. If not, it is the supervisor's call. Probably the only real question is, what if none of the 5 want to serve on the mental health board? Then hopefully by mid-April we will know that, and then it's going to have to convert over to a standard community member for a full 4-year term starting on June the 1st. And now under the Community Mental Health Act, we don't have to go by calendar year to start a term from January through December for a 4-year period. It can start at the beginning of a month. So we have the flexibility, but the progression is the election will come and go. We'll know by mid-April when that if there is an interest among the 5 board members, And with that, then the appointment will be made on May the 21st, and then the first meeting of the new mental health board will be the June meeting. Now, for the community members who are up for appointment, our terms expire. That's myself, as well as member Kemp. The progression will be around 60 days is when the posting will go on the website as far as interested members in the community to, if they're interested, to apply, send their letters of intent, as always been the practice. With the new law for transparency and certainly for interviews, I know looking at some of our neighboring boards, like for instance, I know McHenry County's mental health board, in addition to the county board chair, it's also the president of the mental health board and the executive director sat in on those interviews of, I think you had like 5 or 7 candidates. You had a good pool. And presumably that's going to happen for us too when that time comes towards the end of the year. Of course, if current board members want to reapply, they have to reapply. That's always been our practice here in Dundee Township. So if that pool is to a point where the supervisor will need our assistance to sit in on the interviews, then that's their call. But we want to ensure we start it in advance because those appointments need to be made at the December Township Board meeting of this year, 2025, to be effective on January 1st of 2026. So just want to ensure for clarity that under the new advice component, and we know which mental health boards were kind of the genesis for that new provision of the law, we in Dundee Township are being transparent and thoroughly sharing how that will be implemented, working with our township board, working with the township supervisor. Any questions on this? Okay. Hearing no questions, thank you for allowing me to report that, and we'll see what happens post April 1st. Chair will now entertain a motion to approve reimbursement of eligible ride and cane costs from October through November 2024 of $3,773.64.
I'll move.
Moved by Auger.
I'll second.
Second by Thrower. Discussion, Mr. Sanchez.
Pretty straightforward. It's for 2 months worth. One was a little light, so came a little under average of $2,200, but you see the total there. There's a chart printed out in front of you as well, so you can refer to that if you'd like. That has the the running total and the monthly amount.
Okay. And these have been cleared that these are eligible for mental health board funding. Mm-hmm. Okay. Any other questions or discussion? If not,
yeah, I do.
Okay.
So when back in whatever it was, January, we approved $16,042. So that was for the reimbursement of the months of March through September?
Yes, yeah, the ones that are indicated in gray.
Okay. And then the $30,000, the allocation that we had there is going forward for the remainder of the fiscal year?
Yes.
Or program year, however we want to word it. Okay. So the 3773 is going to go against the 30,000.
Yes.
Okay.
Yes.
All right.
And to clarify, the program year is the calendar year. Our fiscal year ends at the end of this month. So just want to ensure we don't, and thank you for clarifying that we don't trip over our calendars. Any other questions or discussion? All right, being none, Secretary, please call the roll.
Auger?
Approved.
Corrins?
Approved.
Thrower?
Approved.
Avalar?
Approved. We will now move to discussion on the one-year plan update. Mr. Sanchez did hand out a printout of our current fiscal year 2025 one-year plan. We are going to be moving into the fiscal year 2026. Mr. Sanchez, it's your show.
So I think, we did a whole workshop day last year because it was really kind of the first time this board had ever gone through the process. This year it seems maybe a little more simpler. Just kind of the idea of going through each goal, just kind of discuss your ideas. I was hoping we were going to have more of a full board here tonight because we really would like to get all their input on this. But we weren't planning on having it finalized tonight anyhow. So if you'd like, we could just go through each goal, give kind of your pros and cons, your thoughts on it, or do you want to wait until next?
The board is not here. I would want to wait to include them in the conversation. I mean, I think if there's concerns or things that we want to highlight or get a start on in the next 30 days or put some priorities on, that's fine. But as far as just like finalizing,
I'll defer to you guys because again,
Okay,
we're short.
So with that then, we have Member Thrower, Mr. Auger.
Yeah, I mean, I take your point. We don't have, 3 members of the board here, so. But what I'd ask is, can we send this out to the board with a request that they provide their inputs offline so that we're not flailing around at the March meeting trying to come up with it?
Yeah.
If people have suggestions, submit them. Jared, you consolidate them. And I would say get them back out, set a deadline within the next 2 weeks so that people have an opportunity to look at the material before the packets come out.
Okay.
Yeah, and then also, I mean, should we be looking at, some of these, yes, we've achieved them, success, but they're ongoing, right?
Yep.
So just, I don't know how we want to
I think what we,
do that for the next.
I think the demarcating is maybe starting with the goal itself, not so much the bullet points
Okay.
underneath. That's like goals and underneath the
Yeah.
objectives. So let's maybe just look at the overall goals
Yeah,
that will be
okay.
ongoing. Member Corners, did you have anything you want to add?
I would similarly, I would say if we can get that out by email and then be thinking through it in advance, I think that will help spark more conversation.
Okay, if there's no objection, this will go out to the board by email no later than Monday. Deadline will be the 28th, which also corresponds to the end of our fiscal year, so it's a good time for the entire board to be thinking this through, and obviously this will make it into the March 13th meeting packet on time on March the 7th for distribution.
Yeah.
Is that a good turnaround for
Sounds
you?
good. Yep.
All right, any other question?
Well, I guess I was going to recommend, can we pull it up? Say if we're going to send it out by the 17th, request everybody have their feedback by the 24th, and then that way, Jared has some time to consolidate and get it back out before the 7th.
Okay, before we commit to the 17th, let's make it the 18th, because officially the 17th is a holiday. So that'll be if we're an assignment for the 18th to get it
Only
out
for
on
the
Tuesday.
Irish, though, right?
Huh?
No,
It's only for
not
the-
March.
Oh,
February.
Oh,
That's
what's that?
President's Day.
Oh, is that for President's Day?
Okay, we're talking President's Day.
I'm already in March, man. I'm in the future.
All right. So
Yeah,
get it
that's
out by
fine.
no later than the 18th. Get it back in by the 25th.
Yeah.
Good. That's okay for everyone? That's what we'll do without objection. All right. With that, let us move on to board discussion. Chair will entertain a motion. Not a motion. Chair will start with President Pro Tem Augur. Any discussion items?
I attended an interesting training session that ACMI put on called Strengthening Your Network. Talked about some good things about what they were calling middle management challenges. Most of the people online seem to be coordinators, so it was kind of interesting listening to the dynamic about the struggles that they face. The instructor introduced a problem-solving tool called Start, Stop, Continue to help improve the communication and relationships in terms of what's working, what's not working, and what to change. So thought it was a good class and recommend that people keep an eye on things like that. Obviously, depending on your work schedules, it may not be something you can do. The other thing, we are entering into doing audio and video recordings of the meetings, which is excellent. And we've talked about streamlining the minutes so that we don't, use up any more of Jared's time. But have we talked with legal counsel in terms of what our new responsibilities are with respect to storage of the videos, retention of them, and we know all of those rules?
Correct. So yeah, we have to keep those, I forget if it's 5 or 7 years, but we'll have to keep those on file. So right now we're using YouTube, but we may want to look at another way to back them up just in case something were to happen to the YouTube file or the original file. Probably should have like 3 backups.
Okay, so to clarify, from the Township Board, since they started the recordings last month on January the 15th, you're looking at how long you have to keep that, and are you going to put that into a Township Board rule or policy rule?
I think it's dictated by like Open Meetings Act, what the retention is. Same thing
Yeah.
with how long you have to keep your minutes and executive
Okay.
session minutes. It all falls under there. So I can look it up and get that date to y'all. But
Yeah, this is something President Avalar and I were discussing before the meeting today, and wanted to follow up with you to
Sure.
see what your thoughts are on that, because it will be on YouTube, so that's a record right there. But do you want to have a backup?
Yeah, I think
Because
we
we
should.
can't keep storing it on the camera.
Right.
The HD card will get full, so we want to have something offline.
correct.
But certainly, just like with some of the other rules that, Township Boards Council recommended 2 years ago, what the township board will do, whether it's through an adoption of the rule, just simply following the current statute. We, the mental health board, within reason, will do that, and this sounds like one that's pretty clear cut. So, Strauger and
Just a couple more things. So Lindsay spoke about, the work that Pivotal is beginning to do. Are you looking for input from us on the classes still that you want to have, or how are we doing that? Because I'm not sure that I heard how many classes we settled on and when they're going to be, and
I don't have it in front of me, but I think with the work plan, the concept was that, I would be sort of a line of communication with the provider, but filter, requests, thoughts, and ideas from the board, and then they can report to us on what's going on. So it's kind of a little open as far as influence from the board, what kind of presentations the board would think would be helpful in the community.
okay.
Yeah.
All right, and then I'm assuming we've got the same type of process that we have to go through with Mathers, because they were going to be putting on, sounds like, 4 sessions.
Yeah. Mathers had a few other components. With Pivotal, I think it'll be primarily just they hold a session and then there can be a reimbursement that comes from that. So it might, in a period of a month, maybe they have 2 sessions, but maybe 1 month they don't have any, or 1 month they have 3. It could vary depending on the venues that they're scouting and the interest that they find out there. And
Okay. All right, that's all that I had.
Okay, Member Thrower.
We have a new resident to Dundee Township, so welcome. Yeah, congratulations to Heather and her family on the beautiful boy. So we're excited. That's it.
Terrific. Member Corrins, welcome back.
Thank you. I know, I still have been checking all of my emails here and even at work a little bit. I did see something come in through the fair. I think it was Meadowdale that did the fair last year.
Yeah.
But they're about to do another one. So I think in the last meeting I was just thinking through what are those events going to look like this year, and coming up with a calendar. But
yeah, I got to reach out to them. I haven't heard from them yet.
I think the email just went out maybe this week, or
Okay.
I think just this week, because I forwarded it to the person who's kind of filling in for me while I'm gone, who was at the event last year. And I think your email was on there, but if not, I can.
Okay, yeah, I didn't see it, but I can also check if it went to a spam folder or something.
But I think this time of year, there'll be kind of when events will start popping up again with the spring and all that. So
yeah,
exciting to see, and see a lot more activity too on Facebook. So we'll see what happens.
Okay. And just go ahead and segue into the board president update. I thank you all for the thoughts and prayers. My surgery was successful. About halfway through the rehab. Hopefully the doctors will clear me by the end of this month. And I was kept overnight for observation, and it's a matter of thankful to God I'm back here and seeing progress in my recovery. So thank you all again. And like I said, since the last meeting, what's happened? I've turned 60. I had surgery, and a few other things I'm probably forgetting. So, but praise God.
All part of turning 60.
Yeah, I was gonna say that's lumped into that first one. Right?
Like so, and as you know, definitely, Mr. Sanchez knows, I did go to Florida and to bring in 60s, and I saw my friends down there gave me a nice little party and everything. So, speaking of my travels, though, more officially or unofficially, but definitely mental health, I did some training out in Will County over the past week, and a couple of their county board members, and catching up on, Will County is the largest mental health board in the state from a population standpoint. They have just under 700,000 people. And definitely learning, and when they did their first allocation, they were approved at referendum in November of 2022. Their first levy was in late 23, and they levied 10 million, even though 18 million they could have gone to, but they saw their needs. And throughout calendar year 2024, they're still setting up their grant programs. So I think they spent 4 million in pass-through to county resources, which is something I think similar to what McHenry County can do. Of course, we can't as a township. And I think they did an $8 million levy at the end of 2024. So one of our, definitely the largest, but certainly one of the newer mental health boards. They're definitely off and running on a great track. Talking to their county board members, I said, look, great partnership. always work closely with your mental health board. Obviously, there are boundaries, but there are also opportunities for partnerships and doing what's best for your community. And whether it's a geography that's over 10 times bigger than Dundee Township or just our own geography here in Dundee, that's what mental health boards are supposed to be. And certainly, that as long as I've been on this board, I've tried just to do that. I think someone had mentioned coming to the meetings, and I remember attending these meetings going back over a year before I was appointed and learning about how this mental health board works and how the people are working. And it's something that as we move forward, we're going to become a best of best. And if people can learn from us, and we'll learn from others, certainly McHenry County, you've got the history with over 5 decades, we'll learn from each other. Something else that has come up is the spring legislative session is in full swing. There are some interesting legislation as far as mental health boards. I did attend the ACMI Legislative Committee meeting. I'm doing that for the spring session and freeing Jared up to be more of the day-to-day. And there are, apart from the library board suggestion, which came out of Northern Cook, Wheeling Township. And of course, people who know about Wheeling Township, that's been a pain point. But certainly, whether it's going to go anywhere, I do not know. I don't think our lobbyist knows for ACMI, but we're definitely keeping an eye on what might happen there. It should have no impact to Dundee because we already have a mental health board. But in some areas, library districts, you know, it's an interesting suggestion. But I was honest with the lobbyist. You know, is this somebody's way of trying to work around the Wheeling Township board? And that's really not the way this is supposed to work. It's supposed to work with your elected officials, and we'll see what happens there. So that, in addition to other legislation, is not directly impacting us, but the ACMI meeting in Springfield is with our lobbyists. It's going to be primarily about lobbying, whether it's for mental health, substance abuse, individual development disability. Mr. Sanchez, I believe you're going to be going down like you did last year. For the record, for the board, I will be going down, but this is more through my business. I'm not going to be billing the taxpayers. I'm actually staying at a different place where I have hotel credits right across the street. But I do plan to be there in person this year as well, but definitely not at taxpayer expense. So that is taking place, and if anybody else, and if you want to listen to it online, that's an opportunity for anybody here to do as well. Then finally, let's just continue to do the work of the people. And with that, the chair will entertain a motion to enter into closed session for the appointment, employment, compensation, discipline, performance, dismissal of specific employees, and the review of closed session minutes.
I'll make a motion.
Moved by Thrower, second by Corrins. No discussion. Secretary, please call the roll.
Auger. Approve. Corrins.
Approve.
Thrower.
Yes.
Avelar.
Yes. We thank all of you all for being here. We'll be in session. We don't know how long, but you're certainly welcome to stay outside if you want to come back for the report.
We can leave the TV on.
He's going to turn off the camera. He's turning off the camera. We are returned to the regular session of the Dundee Township Mental Health Board. Acting Secretary, please call the roll.
Okay. Time is 8:17. Just for the record, Auger.
Present.
Corrins.
Yeah.
Thrower.
Present.
Avelar.
Present. And now, with actions out of executive session, Chair will entertain a motion to authorize the Mental Health Board President pro tempore to remove executive session recordings off-site for the purpose of preparing executive session minutes.
I'll move.
Moved by Thrower.
Second.
Second by Corrins. Discussion. Roll call, please.
Auger.
Yes.
Corrins.
Yes.
Thrower.
Yes.
Avelar.
Yes. We're going to go to option number C. Chair will entertain a motion to release closed session minutes for the dates indicated by the executive session secretary.
We will release the executive session minutes for Tuesday, January 2nd, 2024. Monday, June 17th of 2024. And July 15th of 2024.
Okay, moved by Auger,
I'll second.
second by Thrower. No discussion. Chair, please call the roll. Secretary, please call the roll.
Augur,
Yes.
Corrins,
Yes.
Thrower,
Yes.
Avila.
Yes. And now Chair will entertain a motion to authorize the Mental Health Board President to execute the independent contractor agreement with Jared Sanchez for the period of March the 3rd, 2025 through August the 29th, 2025.
I'll make a motion.
Moved by Thrower. Is there a second?
Second.
Second by Corrins. Discussion. Consensus of the board is to go through with a 6-month independent contractor agreement, and which will end on August the 29th. And the overall figure for the half year is compensation is $23,548.20, and a review of the contract in the next direction is going to go into effect at the May meeting of the Mental Health Board. Is there any more discussion? If not, Secretary, please call the roll.
Augur,
Yes.
Corrins,
Yes.
Thrower,
Yes.
Avila.
Yes. With business being concluded, the chair will entertain a motion to adjourn until March the 13th, 2025.
On behalf of Chris Kempf, I'll move to adjourn.
I'll second.
Moved by Augur, seconded by Thrower. All in favor, please signify by saying aye.
Aye.
All opposed, same sign. We're adjourned.